I was recently asked a few questions regarding what entails a birth injury investigation when a baby has an HIE brain injury, and what are some of the important areas of review when I'm looking at nursing notes and nurses charting. So when I review the medical records in cases like this, one of the main areas of focus is going to be the nurse's charting. The chart is not just paperwork, it's often a roadmap as to what happened during labor and delivery. There are going to be certain patterns, for example, that will stand out with something like this. And sometimes what I will see is boilerplate language repeated over and over, where the same phrasing shows up regardless of what was happening clinically. That can raise questions about whether the chart is really capturing the unique circumstances of that patient's labor, or whether it's more of a template entries that are being used over and over again. Another issue is what I can see is gaps in the record. If several hours go by without documentation during the time when the fetal heart rate was showing concerning signs, that missing information can leave major questions. Families and medical experts and eventually juries or judges will want to know what was happening during that time and what actions were taken and why was nothing written down during something like this. I also will see vague documentations. And for instance, a note may say that a doctor was notified, but it doesn't mention the time of the call, or it may say that the nurse spoke with the doctor, or, but it doesn't say what was discussed or what were the orders or the instructions based on that conversation. In cases involving HIE, those missing details can be critical. The exact time the doctor was called or what was said in that conversation can mean the difference between whether the care team responded promptly to signs of fetal distress or whether opportunities to protect the baby were lost. Now, with all of this said, I want to be clear. I know that many nurses are going to say that they did not have time to chart everything down because they were busy caring for the patient. And that is true. Nurses are often at the bedside and they're working under pressure and they're making sure that mom and baby get the care that they need. But here's the reality of this. Juries and other fact finders still expect important information to be in that chart. They understand that a nurse can get busy, but they also understand that the record is a part of that patient's care. It tells the story of what happened. It helps protect the nurse, and it provides a roadmap for subsequent providers who may need to step in and take over care. If critical information is missing, it's not just a legal issue, it can affect patient safety in real time. So when I review a case, I look closely at these areas: boilerplate language, gaps in charting, vague or incomplete documentation about doctors' communications, missing times, and whether the record lines up with what was showing on the electronic fetal heart monitor. These are just some of the areas that I review. A lot of times it's going to depend on the issues that are presented in the case, because what may raise concern in one record, it might not carry the same weight in another. But at the end of the day, the medical record is how doctors, nurses, and families, and later juries, if a case is filed, understand what really happened during labor and delivery. And when that story is incomplete, it raises questions that go beyond the paperwork. It raises questions about whether opportunities to protect the mom and baby, whether those opportunities were missed. Again, I'm Marcus Paulson. If you have any other questions about your baby's HIE, brain injury at birth, or subsequent CP diagnosis from a medical legal standpoint, do not hesitate to reach out and contact me. You can find out more information about me and my profile. If you're watching this video on certain apps, you can send me a DM and we could chat a little bit about your baby story, or you can just wait and watch the picture that follows the end of this video. All right, that's going to be it for today's quick educational video. Have a great day, everybody.